This is endoscopic image from previous hospital taken 31 days earlier. A large pedunculated polyp in the transverse colon was revealed. The stalk length was approximately 50 mm. Head size was approximately 50 mm. The polyp occupied the lumen. After thorough cleansing with clear water, the mass effect made snare application difficult and suggested the endoscopic resection be technically challenging. The magnified band imaging determined the tumor to be genetic classification type 2A. The endoscopic findings were consistent with diagnosis of adenoma. One 10,000 diluted epinephrine was injected into the tumor apex. A total of 10 mm was administered at 4 sites with 2 to 3 mm at each site. However, most of the injection at the polyp head leaked out, resulting in only limited submucosal infiltration. This was followed by injection of the stalk. Total amount of 10 mm was injected into 3 sites in the stalk. Five minutes after injection, the polyp became dark red. However, the head didn't show sufficient reduction in size. To achieve a great reduction effect, we attempt a clip placement at the base of the stalk. A total of 6 clips were applied. However, due to a large tumor size and the resulting poor manuality and visualization, achieving effect clip placement remained difficult. Although the polyp head turned red and the stalk became white, sufficient size reduction was not achieved. Due to the limited visualization, it was remained unclear whether the 6 clips were placed in truly effective positions. Three weeks after EVR with clip placement, the polyp had greatly reduced in size. The size of the polyp is approximately 20 mm. The stalk size is approximately 20 mm as well. Magnified NBI image was still determined as genetic type 2A, and endoscopic findings was still consistent with the diagnosis of adenoma. Clear water was injected for underwater EMR process. The polyp was securely grafted just above the clips using a 25 mm two-step loop snare. After grasping the region with a snare, resection was performed using a forced progression mode of the electrosurgical generator. The lesion was removed in block, without perforation or bleeding, and no residual tumor was observed at the resection site. After resection, 4 clips are applied to ulcer base as a prophylaxis against the bleeding. Histopathology revealed pedunculated tubulovillous adenoma, measuring 18 mm with negative resection margins. Conclusion: a 50 mm giant pedunculated colon polyp was successfully managed by endoscopic mucosal resection 3 weeks after epinephrine volume reduction with clip placement.